Hello everyone, welcome to Global Health Watch. I'm Dr. Xiang Ling. Because this is a new channel and I also speak Mandarin, so I actually producing two versions of the program, one in English, one in Chinese. So if you are my subscriber, if you receive the Chinese programs, don't be surprised. And so I also put these programs into separate playlists. And so if you want to look back for my previous program, you can check a different playlist. So today's program is about WHO, World Health Organization, sending a team, a so-called independent team, to China to investigate the origin of the COVID-19. So this was a team that's supposed to go to China last year because in last May, under the pressure of 110 countries, led by Australian government, the WHO agreed to have an independent investigation about the origin of the virus and into China. But Chinese government keep delaying in the negotiation, in the authorization of these teams. So finally, January 2021, there's a team going to China, and they landed in China on January 14th, the Thursday. So the members of the team will first be quarantined in China for 2 weeks, and then they will conduct their own investigation in Wuhan. So people questioned what kind of result that this team can get. Will their investigation be genuinely independent? So bottom line up front, I will tell you my observation, my concern is that this is more like a political show than an independent investigation. Why? So first, the timing, right? This team supposed to be in China early last year, or even the latest in last summer, but now this is January 2021. They are too late. Right now, if there's an independent investigation team in China, they should go to Hebei Province, they should go to Liaoning Province, where the Chinese government has locked down more than 10 million people in these provinces, in these cities. And the outbreak in those regions are very, very severe. And the government has initiated screening, nucleic acid test screening for all members in those cities, in those provinces. It's a large scale screening, and you can see many of the photos, videos from China, people line up crowded in those testing sites or in the travel like gate, and it's a chaotic situation, and many people were even forced to lock down in the driver's cabinet, in the trucks, and it was a chaotic situations, and many of the communities have to be gated, and even people only allowed it to shop for their daily needs once in a week. So it's a very, very devastating situation in many cities in China right now. So if you have a team from WHO experts, including virologists, epidemiologists, right now you should go to these cities, not Wuhan. Yeah, Wuhan is no longer the hotspot, it's no longer the ground zero. And you should go there to investigate whether the Chinese government have sufficient resource and efficient measures to contain the outbreak in those cities, right? In Hebei Province, not in Hebei Province, but in Hebei Province now, right? So the timing definitely wrong, and their mission is questionable right now. And also, will this team able to conduct genuinely independent investigation? This is fundamental because Chinese government has been controlling the propaganda, controlling their messages in terms of where the origin is. We can clearly remember, right, last year at the beginning they blamed the Huanan seafood market was the original outbreak spot in Wuhan city, and then later on they changed their story. They're blaming other countries bringing the virus into China. So right now, will they allow these team members to truly conduct independent investigation? I question about that. And later I will talk about the you can say clandestine investigation conducted by AP. I'll talk more about that later. But another major question about these WHO team is who gonna write the report. We probably remember there was a team from WHO went to China in last February. This team only have 1 day in Wuhan, so but they have a full report, but the report was composed half by the Chinese scientists or Chinese officials, and then some of the report was written by the experts from outside China. So it was a joint report, and you can even find clearly, Chinese official languages in that scientific report. So kind of like a very, very funny, propaganda tools. You can find it saying under the Chinese Central Committee's leadership, we have find these diseases. It was so interesting to read that. But that just tell you that report is not independent. It was, you can say, it's prepared, it's cooked together by the Chinese government. So right now you have a new team going to China where Chinese government allow you to publish anything that's contradictory to the government's official tone. Who will control the publication? Who will censor some of the information in your report, right? So this is a big question. That's why I feel right now, when you have a team going to China to do this investigation, it's more like a political show. It's not a genuine, independent investigation. And also right now, more importantly, whether the virus originated from Wuhan or not is not that critical anymore, because under Xi Jinping's leadership, Chinese government have pushed every province in China to build up new P3 lab or even P4 lab in certain locations. So Chinese government is making a great leap forward movement regarding building the P3 or P4 lab. And you probably remember last year, the Department of State has informed the public that they once sent a team, an expert team, to Wuhan Institute of Virology on 2018. And the report came back regarding about the safeties and security procedures in Wuhan Institute of Virology was very worrisome, because they see even the top research institute in Wuhan did not follow very well in terms of lab safety, lab secure protocols. So how can you expect the newly established, newly built lab in different provincial level can truly follow safety procedures? China may not have enough time to train enough lab safety personnel to manage these P3, P4 labs, right? So it's like China is building more Pandora box, and you are facing more virus leak from the lab. So that's an even bigger problem. And many of these provinces from their hospital, they can easily collect COVID infected patient samples. They can grow up the virus easily in this kind of lab. But who will control the safety of the lab? This is a big issue. That's why I call it, it's like building more Pandora box in China. So if you have a team from WHO, you need to investigate these problems, right? You need to find out whether China can enforce very strict rules in these kind of P3, P4 lab. And you have to see whether they have enough personnel that can do it. So, but right now this team is going to China say we're going to investigate the origin of the virus. So one of the experts from this WHO team is named Dominic Dwyer. He's a virologist from Sydney, Australia. And he clearly told Australian broadcast company, Australians ABC, he told them their mission is not to find out who's the patient zero. And they only expect to find out whether this outbreak was amplified in Wuhan whether the outbreak may started from somewhere else in China, and they want to find out whether there will be an intermediary animal host, and also they want to find out what's the role of laboratories in all of this. So you can see these experts, they know it's very hard to find out who the patient zero is. So this is actually clearly telling the Chinese hospitals in Wuhan may not collaborate with these WHO team in a full collaboration pattern, right? Because we from Chinese internal document, we know the Chinese government, Chinese National Health Commission, as well as Hebei Province Health Commission, has already ordered all the hospitals in Wuhan to track back patient records all the way back to September 2019 to see if any of the patients showing symptoms similar to COVID-19. So this is government secret operation that has already conducted last year, and now they won't release this information to the WHO team members. So of course these experts from WHO, they know they cannot find this kind of information. They don't expect to find who will be the patient zero in 2019. So what they can do, right, maybe simply just collect some animal samples and try to find some animal being infected by the COVID-19 and having additional animal to be suspected as intermediate reservoirs. Because Chinese government has already pushed out different series, right? The bats or maybe the pangolins last year, even though there were publications in China. But later on, many people question about the studies regarding pangolin could be a potential animal reservoirs for the COVID-19. So right now, it's really too late for the international society to try to find out what will be the animal reservoir for the COVID-19. Because if Wuhan is the outbreak, because if Wuhan was the outbreak center in 2019 and early 2020, the Chinese government has already collected enough animal samples, because there were so many top virologists, epidemiologists in Wuhan. They definitely know they need to collect animal samples. They already test different animal samples, but they probably just cannot tell the public regarding what they found in animal samples. One report I did see is from Dr. Shizhen Li from the Wuhan Institute of Virology. Her team collected samples from cats, whether it's wild cat or domestic cats. She collected cat samples, and clearly her results showing that cats can be infected with SARS-CoV-2. So that report did not make clear conclusion whether people can transmit the virus to the cat or whether the cat, infected cat, can transmit the virus to human beings. And so, but it's clear that the cats can carry the virus, right? So right now, for international experts going to Wuhan, what kind of animal sample you can collect additionally, right? The Huanan seafood market is probably no longer there, and what can you do? Collecting more samples from other animal market in Wuhan. So I really doubt that any concrete result can be made from this WHO team. And also another big question is, if you want to understand animal reservoir, if you want to understand animal origins, you definitely need a research team to follow your investigation. So even if you collect samples in China, who's gonna conduct the experiment? Will you bring the samples out of China to do independent research, to do sequencing, or will you rely on Chinese scientists to conduct this research? This is another question, right? So anyway, I'm not optimistic at all in terms of the results coming from a WHO investigation team, because I'm questioning whether they are independent or not. So also another reason that I really doubt the effectiveness of this WHO team is because I read a recent report. It was about a clandestine investigation conducted by Associated Press, and this report was published last year, December 30, 2020. And from that report, we can clearly see, even for Associated Press, a major news agency with many resources, they cannot conduct very effective investigation, even clandestine investigation in China. They went to Wuhan. They were managed to interview one of the vendors, owners, originally working in the Huanan seafood market, and that gentleman told the investigators how he originally identified some people who got sick, and some of his friends even died because of the COVID-19. But how did it start it? That person had no idea. And the investigation team also went into Yunnan province, where that's on the southwest of China, where there were a lot of the caves harboring the bats, right? Bats as potential animal reservoirs for SARS-CoV-2. But the local authorities, the county authorities, the police were ahead of these investigation teams. They were quickly blocking the reporters to assess the caves or the mine shafts, because one of the reports from Dr. Shi Zhenli from Wuhan Institute of Virology clearly indicating that one virus strain named RATG13 was collected from a mine shaft in Yunnan province in 2012. So people question about the validity of that particular virus strain, the RATG13. But even if it's true, the investigation team from Associated Press cannot assess the cave, cannot assess the mine shaft because the local authority block it. So, China is already in a surveillance state situation, right? So many cameras everywhere, they can easily track where you go. As a foreigner, even if you conduct clandestine operations, communist regime very easily to pinpoint where you're located, what you want to do, right? So they can effectively block these kind of clandestine investigation. So for investigation by WHO team and need approval from the Chinese government, what kind of freedom you might have in China? Can you really conduct independent investigation? I fully doubt it. And anyway, so just want to share you about my observation regarding about WHO's team, which is going to China to conduct an investigation regarding the origin of the virus. Originally, I thought this is purely a political show and nobody interested. But yesterday, I actually was invited to join John Batchelor's show together with Gordon Chang, and we were discussing about this issue. So I feel actually there's a point I need to share with everyone in terms of how Chinese government covering up the situation, and also Chinese government has been implementing very strict rules, strict policies in terms of scientific publications regarding the virus origin. The Associated Press investigation also were able to collect some of the internal documents from Chinese state councils or from national health commissions, and those secret documents clearly indicating the control was implemented all the way from the top, from Xi Jinping, and then come down to provincial level, to city levels, and they order all the scientific research, all the hospitals. If you have any publications, you need government agencies' approval, not just a scientific approval process. You have to get government propaganda bureaus' approval. Anything, any results that's contradictory to the government's terms will be censored, and the government can fine the scientists who want to back up the government's official tone to have publications, for example, showing, maybe they can identify COVID-19 on the outside of frozen food packages, and those packages were imported from other countries. So if the government wants these kind of propaganda schemes, they will be able to identify scientists to publish this kind of data. So that's how it works in China. So the Associated Press investigation report clearly give you this kind of picture, and it actually remind me, I cannot just look at the scientific report from China. I need to think about what the government's propaganda at that time, where the report actually basically want to support the government's tone. Right? In China, everything is political. Everybody need to keep this in mind. It's not purely scientific research in China. Right? So anyway, that's all I want to share today. So basically, my conclusions don't trust the results coming from the WHO's investigation team. What they can find is very limited, maybe very biased, maybe only show you a little bit of the results, but it won't give you the full picture about what really went wrong in Wuhan in 2019. I don't think so. I don't think they will find anything very valuable, and it's a wrong timing. And what we should focus on is what went wrong in Hebei Province, in Liaoning Province, what kind of mutants is circulating in China. The Chinese government is not releasing these kind of critical informations, and these are very, very important, and not only important for the American people, for the world, and for Chinese people. They also deserve to know the true situation in China. If the government locked down a city or even a province doing nucleic acid screening for everyone in the city, in the province, that suggests the situation is much worse than what was reported on their local health commissions or national health commissions. So be alert. The very dangerous mutants has been popping up in many countries right now. We know, in South Africa, in Japan, in Brazil, in Nigeria, in Russia, very dangerous immune escape mutant has been identified. And China, they also have one case in Guangdong being reported, but the full sequence, the full mutation profile was not reported. So we definitely need China to be more transparent in terms of the new mutants that emerge in China, or even already become dominant in some of the northern provinces in China. I think Chinese people deserve it, and the world need to know it more. All right, that's my conclusion, and thank you for watching today's Global Health Watch. This is Dr. Xiang Ling. If you like my program, please help share it out and click subscribe, and hope more people can benefit from my program. Thank you very much for watching. This is Xiang Ling. We'll see you next time.